Good afternoon, everyone. Thanks for tuning in to this special webcast. We want to have a conversation with you about what school looks like in 2021 as we look to reopening in person and remote learning on the other side of this new year. Looking back in the past couple of weeks, Governor Beshear issued executive orders that closed most schools in the state to in-person instruction for the period that we are in right now, with the exception of our elementary schools. And we really only had a handful of those over these past couple of weeks that have been able to open because their numbers were such that their communities were in the orange category or lower on the Department of Public Health's color-coded decision-making framework. And our secondary schools have been closed for this period of time. But all of that changes on January 4th. And so now our eyes turn to what does that configuration look like, what questions are out there, and how can we best make sure that we're supporting our students with quality learning experiences and doing what we need to do to keep our staff, our students, and our communities safe. The governor is now considering the policy framework of what reopening schools in January looks like. That's the purpose of our conversation today. Yesterday, Governor Beshear talked about 5 different criteria or areas that would be conditions or where changes would be made. And with those, there would be a restoration of local decision making when it came to the learning model that was in place. We're going to explore those 5 areas and talk about them, gain your feedback on what your perspective is on those. We've also heard from superintendents and school leaders across the state that there's a desire for you to have input on those decisions. So we have a feedback, a data collection tool that we're going to send out during this meeting to gather your feedback and thoughts and provide those to the governor as these decisions are being made. Also earlier today, we sent out vaccine guidance. And so recall a couple of weeks ago, the governor had us together and informed us that vaccines were on their way and that educators were being prioritized in the distribution of those as they came in. There was still a lot that we didn't know then. We know a little more now, but there's still honestly a lot that we don't know around what the timing on that looks like and what that distribution schedule will look like. But one step that's in that is the collection of names and who is willing to take the vaccine from schools. And so we've sent out guidance to you on that today. You should have that in your inboxes if you haven't seen that. And so we're also going to process through that. So a lot of stuff to talk about. We have a lot of folks on with us, guests on with us today to help us think those through and answer your questions and gather your feedback on that. So Tony, why don't we share our agenda and we'll walk through what we're looking at for covering today.
So there's the feedback form that the commissioner was talking about, and you will get a link to this in your email boxes right now, hopefully here in the next few minutes. Just wanted to make sure you knew that there is a separate Google form aside from the questions, the Google form that you send to us that submit questions. And I'll go ahead and share the PowerPoint. If the technology will allow me to do so. Give me a moment.
Well, Tony's working on that. I'll go ahead and give folks the rundown of who we'll hear from. We have Dr. White on with us for a limited amount of time, so we're going to allow Dr. White to speak first and hopefully push through the rest of our presenters so that when questions are available, she's on and available to answer those. We also have on with us Associate Commissioner Kelly Foster, who's been working closely on the reopening guidance. We have not released that yet. The reason for that is that we are waiting to get the final orders and regulations in place before we release any guidance documents. We really want to make sure that we're not providing information that later is not in alignment with or not in doesn't comport with the final executive orders and information that the governor issues. So we're holding on that, but we can provide you some details on that. And again, this is an opportunity for you to provide input and for us to get feedback on those. We have on Angie McDonald, our nursing consultant, and Kelly will also talk about the vaccine guidance that went out today, and we'll close up with hearing from Tony on communication updates and hear your questions and feedback and do our best to answer those. If we are not able to answer questions with you today, we will take note of those, log them, and then work to get those answered later. I know that there's a lot moving. There's a lot of moving parts and things that are still up in the air. We're working quickly to try and resolve those and provide you clear direction on what reopening school on the other side of this year looks like. So let's turn things over to Dr. White. Dr. White, thanks for being with us this afternoon. We'll share your slides and turn things over to you. Thank you.
All right. Well, thank you so much, Dr. Glass. I appreciate being here. I want to just kind of do a rundown quickly of where we are in the state of Kentucky with COVID right now. If you didn't see the governor's press conference yesterday, next slide, Tony. This is I think the governor calls it the stair step slide. I call it the purple slide. You've all seen this before. This is each week since the pandemic started on March the 6th. Total number of cases tallied during that week, and that week goes from Monday through Sunday. So this shows you where we have been, and you can see the alarming rise that we have had over the last few months. In fact, Tony, if you hit the next slide, I'm not a statistician, but I drew a little mark on there so you can see what that exponential fear that we had. We feared that we were going up at a rate that was just not sustainable. We have not seen this last week. We did not see the increase where we had feared it would be. Now, I'd love to say the trend is we're going down, but I do know enough public health to know that two data points don't make a trend. 2 data points just mean 2 data points. But we are very hopeful that we have at least slowed or plateaued this increase in the cases that we were seeing that was so concerning. That little graded line down on your far right, that's the 1,700 cases that were reported yesterday as we begin to collect numbers for the next week. So you can see that we had an increase back in April when we first found the first cases of COVID-19. We had another increase in the summer around the 4th of July, which is when the mask mandate and some of the restrictions were put into place by the governor, and we plateaued out. And then in the fall, there were a whole host of things. There was Derby, there was Labor Day, there were lots of other things happening. We reopened some things, and so we started seeing our numbers go up. And then after Halloween, that's when we saw our huge increases. So hopefully with the measures that have been put in place, we will see a leveling off again. Next slide. If you didn't see this is something that new that is being developed for the press conferences, so people can kind of get a better idea of because people are always asking, well, what parameters are y'all looking at? How are you making your decision making? And I think this gives you some really good ideas. This is the state broken down into 10 hospital regions, and it shows you the ones that are in red and yellow are of concern. We're looking at inpatient bed capacity, ICU beds, and ventilators. Every day, every hospital in the state reports to a system that we have in place in the Department of Public Health and our preparedness branch, and gives us an idea of where we are. Because if our hospital capacity, if our hospital system breaks down, then we are all in deep trouble if we do not have the ability for not only people with COVID, but for people with other medical illnesses to not be able to get a bed, to be able to get an ICU bed, or if there's any ventilator capacity issues. You can see from this slide that our ventilator capacity is actually pretty good for the state of Kentucky compared to, if you can remember back what happened in New York City, where decisions were being made. I have 1 ventilator and I have 3 patients, who gets it and who doesn't. We have not gotten even close to that in Kentucky, but you can see in Region 4 and 10, the magic number is 85. So Region 4 has 87.8% of their ICU beds are occupied when this survey was taken on the 14th. And then you can see that in Region 10, they're up to 93% and a half of their ICU beds are occupied right now. Then in Region 8, a little better, they're 83% of their ICU beds occupied. That can change quickly as people get sick, and we don't want it to be close to a capacity issue for healthcare of all Kentuckians. Next slide. So we're going to be looking at we call it the color code, the instructional metrics that y'all have seen before, but this is the updated metric that I don't know if this has been sent out yet. This is something that the Department of Public Health and the Department of Education has reviewed, and there are changes in this metric. Probably the most important thing you can see is at the top, there is no percentage. This applies to now. This is where we are right now, and changes will be made if we feel that our healthcare system is in despair, or if we are concerned about that system. So let's go to the next slide, Tony, because I want to focus on orange and red. The green and yellow really haven't changed, but you'll see that there's a change here in the orange where it talks about hybrid or remote learning. That's a different phrase than what was on there before, but it is making sure that people understand when you're orange, let's don't get to red. Now, I think now many people would think that being orange would be a luxury compared to where we have been over the last few weeks. Yesterday, there was only one county that was orange. But as we look at orange, accelerated community spread, hybrid and remote learning are things that we want to truly think about. The next slide shows you the changes that you see in the red. So on this slide, you can see that instead of it saying closed, it says more aggressive hybrid, consider remote learning. It talks about all students and staff entering the facility must practice the hands, face, and space that we've talked about. Implementing that more aggressive hybrid model to reduce the volume of students and educators in the facility. If you try to get all of your students in there all at the same time, that physical distancing is, from what I understand, pretty impossible to achieve. So that hybrid model is going to be very important during a time of a red county. If classes are suspended, active remote learning for all learners, so not just for regular classroom, but for AP classes, for any class that there's a way it can be done remotely. That is the instructions that we are hoping, again, trying to get kids back in school and be sure that they're getting that consistent learning. And then we added a section here to try to be sure that communities understand that this is not all your responsibility as the superintendent or as the educators in that community. This is a community-wide issue, and everyone in the community should be rallying around saying, let's figure out how we can make the community safer so it makes it safer for our schools to be in session for students as well as for the staff. And then we just added at the very bottom, we added extracurricular activities in there with athletics. Extracurricular activities is a separate bullet in all of the other columns. So those are the changes that we're looking at. I think we're just trying to, and most all of you are already doing all of this. You're already thinking these things through. You are the thought leaders in your community, and these are ideas that you already have as to how you're going to make an even extra effort during this time when we have so many red counties to try to protect the people that go into your school. Next slide, I want to go these are thoughts. This isn't a slide from the CDC or anywhere else. These are just the things that I thought about. I've had lots of questions about the vaccine, and I know later that Dr. Foster and Angie McDonald are going to talk about vaccines. But these are some basic things that I want to be sure that people understand very clearly. Safety is a key. I think when the project was called Operation Warp Speed, that made people hear this isn't being done safely. This isn't being done by protocol. Corners are going to be cut. This is going to be done faster than ever. Well, it has been done faster than ever, but that's because of different technologies in developing vaccines. When it comes to testing, the testing phases have been carried out. The data is being analyzed, and the safety of this vaccine is something that I will be very comfortable when my turn comes to take this vaccine. So safety to me is key. I had a question at a call in the other day that, well, this has got DNA in it, and it's going to change our DNA, and it's going to be dangerous. This vaccine has messenger RNA, which is very different than DNA. It doesn't get into the nucleus. It doesn't get into the DNA. The messenger RNA that's in this vaccine will dissolve within a few days. So there is no danger of this causing some kind of DNA changes in anyone. We've talked about before healthcare workers and long-term care facilities being the Tier 1A, and that's ongoing right now. This is because, again, we need our healthcare system to be managed by people that are healthy. And we also know that besides the fact that long-term care facility patients are the ones that are dying at the highest rate, they often do not die in the nursing home. They do go to the hospital. So that leads us to lots of admissions, lots of healthcare equipment being used on those patients, and if we can stop that type of that large group of admissions, then we're going to be able to stand up our healthcare system a little bit better. Okay, so the first two vaccines, the first vaccine that is out right now, the Pfizer, is a 2-dose vaccine, and the Moderna, which will be evaluated this Friday and Saturday, will also be a 2-dose vaccine. So the federal government is holding that second dose for us so that we'll be sure and have that. So when the time comes, that will be shipped to us, and we will have records of knowing who gets that second dose. Side effects are very similar to the side effects you see with flu. If you had asked me this time last year about side effects with flu, I would have probably just done a little emoji eye roll, because I've gotten a flu vaccine my whole life and never had a problem. And this flu vaccine, about the next day, I was sitting around, and all of a sudden I felt feverish and I felt awful, and I went into a little drama queen episode of thinking I had COVID. And then when I tried to get up from the chair, I couldn't move my arm because it hurt so bad, and I finally realized, oh, this is what people talk about. It was gone within a day. Most of these side effects are gone within 2 days. But it is recommended, as you're thinking about vaccinating your team, that you look at vaccinating them staggered, if there's any way you can do that. So that way, if the next day some of your team does feel feverish and not feel well, you're not going to end up with a lot of absences because of that. There is no cost to this vaccine as long as these the government issued vaccines are being put into the immunization registry. There won't be a cost to staff for the vaccine. The concern about anaphylaxis, anaphylaxis is the most severe form of an allergic reaction. Of all the vaccines they've given in the United Kingdom this week, only 2 people have had that reaction, and both of those have had an anaphylactic reaction to a vaccine or an injectable in their lifetime. So this does not mean if you have asthma, this does not mean if you have an allergy to bees or shellfish or any of the usual allergies that most of us think about. People with those type allergies can still take this vaccine. It's people who have had an anaphylactic reaction to a component that could be in the vaccine, or people who have had an anaphylactic reaction to an injectable. That is a very, very rare group of people. So people with allergies absolutely can take this vaccine. And if you've had COVID-19 before, do you need to take this vaccine? Well, yes, we are recommending that. We have watched some antibody studies of people in Kentucky who have had the documented COVID-19 infection, and we have noticed that antibody levels after about 3 months in many of these people go away. So we're concerned that that person's ability to not get infected goes away after about 3 months. After we found that information out, we began to see people in Kentucky having a second case of COVID. We've not seen one yet that's been much less than 90 days from their first case of COVID. So we know that the vaccination lasts longer than 3 months. We've been watching the people who have heroically signed up to volunteer for these studies. So we definitely think that if you've had the infection, we want you to get a vaccine. Now, if you're in your isolation period and you're still sick, please don't come in for a vaccination. But if you're past that, we do recommend that people get the vaccine. So those are just some of the things that top of mind came to me that I wanted to be sure that you all knew the facts about this. So when people come to you with these questions, you have that information. I believe that's all of my slides, Tony. And so I'm going to turn it over then to the next group, and I'll be available for questions.
Okay, thanks so much, Dr. White. We always appreciate you coming on and exciting information about the vaccine, and we'll be sure to gather some feedback for you on the changes to the color-coded decision-making matrix and see if we can answer questions about that. We're going to move quickly now and have Kelly Foster and Angie McDonald on to talk about the COVID-19 vaccination guidance that was issued today. Kelly and Angie, are you on?
Yes.
Okay, go right ahead.
So obviously, Dr. White is the expert when it comes to vaccines. I am just here to give you a little information about the document that you received today. It is also posted on the KDE COVID-19 page. It's the first item at the top. So move to the next slide, please. And I'm not going to read all of this to you guys because we really want to take advantage of our time with Dr. White. But the key piece of that guidance document is about putting your rosters together. I know several of you all have already started to survey your staff or make lists within your buildings. So there are some specific things in the guidance document that you have to do in order to make sure what you're sending to public health is accurate. So we ask in the rosters, there are going to be 4 columns. You need to identify the district name, the school name, the employee's first name and last name, and their age. And it needs to look just like that, a number. We don't want it spelled out. We don't want initials for the school name or the county name. You need to follow the guidelines in the actual document. And also just to keep in mind that all employees of the school district are eligible to receive the vaccine, not just certified employees. Next slide, please. Some additional information, just going a little bit deeper about the rosters and the information that were requested. We'll move down to the third bullet there, or actually the third bullet. Itinerant staff should only be included in one roster. So if you're the speech pathologist that works in 2 different buildings in the district, that person just needs to be on one school list. Also, part-time or contract staff, such as coaches, physical therapists, third-party after-school program providers, they also either need to be on the roster of one school or the other district staff roster. And then, of course, you have people that come in your buildings that are really not in contact with students, maybe carpenters or vending machine attendants, electricians. Those people are not eligible for the vaccine under the school criteria. Next slide, please. Important note, due to the limited number of vaccines and the logistical challenge of the statewide vaccine distribution, only individuals on the roster will be allowed to take the vaccine during the educator distribution period. So that's real important that you share this information with your staff. And Dr. White, feel free to chime in. If your name's not on the list, then when it comes time for the education window to open, you will not be eligible to, add your name back to the list. Is that correct?
Yes, and the reason we want name, age, and school is we're not going to be taking, Connie White's name and seeing if she signed up or not. That's not the point. The point is we're going to take this roster and we need to order how many vaccines do we need for Connie Elementary School. And so Connie Elementary School has 45 people sign up. Well, then when we do order the vaccine and allocate that for Connie Elementary School, we want to make sure we have enough vaccine. But we won't be ordering extra, at least certainly not at first, until the manufacturing really ramps up and we have lots and lots of doses. So we we want names and ages so that if I show up and say, hi, I'm Kelly Foster and here's my ID, and they look at that ID and it says I'm 24, well, there's no way I'm passing for 24. So they'll know that I'm not really Kelly Foster. So the roster is 2 things. It's so when we order the right number, and when people come to get their vaccination, whether it's done at the school or whether it's contracted with the local pharmacy or whatever mechanism that community decides to use, we know that, yes, I signed up and here I am, and check me off and give me my injection. So that's what the roster is for. It's nothing more complex than that.
Next slide, please. I think Dr. White just said I can no longer pass for 24, something along those lines.
Neither one of us can pass for 24, Dr. Foster. Sorry.
Okay, the next slide has some important information, and this is in the guidance document. The rosters need to be submitted to Public Health by December 30th of 2020. So we do have a short window, but the sooner we get the rosters in, the sooner the process can start. And so the email address is on this slide and also in the guidance document. This email address was just created today, and a big shout out to Public Health for making that happen very quickly. That way you all would have that information and we wouldn't have to send out additional information regarding where you send it. So there are some step-by-step instructions here on how you put that into one file. So Public Health won't have a zillion different attachments and emails to deal with. So I will just go on and say, as you start to do this process, and if you have questions, just reach out to me via email and I will help you walk through that process. But it's very detailed and spelled out there. But if you do have issues when submitting, just let me know and we can work through that. Next slide, please. I won't go through all of these. These are just some considerations for vaccine distribution. And of course, Public Health doesn't know exactly what this is going to look like yet. So some of this information may change as far as the distribution. And just know that this is kind of a rolling document. So more info could possibly come about this. But one thing I will note on that last bullet, even after the vaccination occurs, that Healthy at Schools guidance still should be followed. You've probably heard on the news and in the press conferences, masks are still going to need to be required once someone does still have a vaccination, because not everyone will get one at the same time. Okay, next slide, please. There's some information in your guidance document about mandating vaccines that you need to look at, and you also need to talk about with your local board attorney. Next slide, please. Okay, so that is all I have around vaccines. I know that it's an exciting time. It's a lot of information to digest. You've just had it for a brief amount of time. So really take some time and go through that guidance document. And then if you have specific questions, feel free to reach out to me and we will get you an answer.
And there was a question about private schools. So yes, these vaccines will be also offered to the private school community, and we'll figure that out, but that will be a problem that y'all won't have to deal with.
Thanks very much, Kelly and Dr. White. We appreciate you being on and sharing that information about the vaccines. Very exciting. We're going to turn now to, I'm going to recognize the Lieutenant Governor and let her say a few words about school reopening in January. And we also have Kelly Foster is going to remain on with us. Kelly's been doing a lot of the work on the guidance document that aligns with the governor's executive order, pending executive order, and any changes for what the policy landscape looks like for January. But Lieutenant Governor, let me turn things over to you now to just share a few thoughts and remarks on what school in 2021 looks like.
Thank you, Commissioner Glass, and thanks everybody. First of all, it's great to be with you this morning, and also again here today, and to be able to plan to return to in-person classes and know that the education community is being prioritized and the vaccination process is the best news that we've had in a long time. And so I just want to make sure that everybody is prepared and gets that information together so that we can get this vaccine through our communities, especially the education community, as quickly as possible and safely as possible, as we return to school in some form or fashion after the holidays. I know I've talked with many of you. Dr. Glass has as well. I've met with teachers. He's met with teachers and parents and students as well. And so we tried to do as much as we could to stay in line with the public health guidelines and follow those while allowing as much flexibility as we could, knowing what we know now after having been through a couple of pretty difficult spikes with COVID-19, knowing that this is now time limited and knowing that we are putting these measures in place just for the foreseeable future so that we can move through with the vaccinations and start to return to a little bit of what's normal. So thank you guys for your input. Thank you all for making yourselves available and having open and honest conversations with us so that we could take your feedback and produce this document. Of course, not everything each one of you wanted individually is in here, but I do think it is probably the Goldilocks plan, trying to get this right and balancing between keeping everybody safe and healthy and returning to in-person classes, which we all know needs to happen as soon as possible and as safely as possible. So I'll leave that there, and we can let Dr. White answer questions since she's the expert.
Okay. Thank you, Lieutenant Governor. We appreciate you being on with us. And just so everyone knows, Lieutenant Governor has been personally involved in all of these conversations. So she really serves in spirit and in action that role of Secretary of Education. So we appreciate you being on with us, Lieutenant Governor. I think what we'd like to do now is I'm going to share my screen and the Google document that was in your inbox that is requesting feedback from you on the 5 areas that the governor has put forth for changes in education policy starting in January to allow for that return to in-person learning under a few conditions. I'm going to do that really to encourage you to provide that feedback in the Google form. We want to make sure that we capture that. And I'm also going to have Kelly come on with me here and provide any perspectives that she has on these elements, again, as she's been working to try and develop guidance from KDE to you on these matters. And Lieutenant Governor, please feel free to chime in with your thoughts and perspectives on any of these as well. So I'll share my feedback form first. Can you everybody see that okay?
We can.
Excellent. Thanks so much. So the feedback form looks like this, and we'll start with this first element of it. So there are 5 main components to what the governor is putting forth for January. The first of those is a recommendation, and I want to emphasize that it's a recommendation from the governor to for schools not to reopen for in-person learning until January 11th. That would allow roughly a 10 to 14 day period following the holiday. So this is a recommendation. It is not a mandate. You can choose to follow it or ignore it. Professionally and personally, I think there's a good rationale behind this recommendation. We know that we're likely to have families that are together during that holiday period. It's an opportunity for this virus to spread. And if we can delay that return to any in-person learning for that 10 to 14 day period following December 25th, I think that makes some sense. And so there's a recommendation that's put forth here. And so we're asking you, what are your thoughts about that? Do you support that? Would you like it to be modified? What are some thoughts that you have about that? Kelly, Lieutenant Governor, anything that you would weigh on here, or Dr. White?
I think you've covered that one, in my opinion.
Okay.
Agreed.
Great. Let's move right along. And so the second one, you heard from Dr. White, the changes in the orange and red levels on the color-coded decision-making matrix from the Department of Public Health. You heard from Dr. White on what those changes specifically were. Again, this document is also remaining a recommendation document, so it's not something that's mandated. It's not something that you have to follow, and it's changing some of the language that will still allow for in-person learning to take place at these orange and red levels. However, they are recommending shifts in how many people are in the building. So shifting to those hybridized models more aggressively is the term that's used in the document. And what that means is to find ways to have fewer students in person in class, to better allow for that social distancing and having fewer people exhaling in a space together. As we know, this virus is transmitted through respiratory droplets. So again, this is a recommendation, but it does recommend that more aggressive hybridization models or shifting to remote or NTI models as you reach these elevated levels on the color-coded matrix. I'll stop here. Kelly, Dr. White, Lieutenant Governor, anything that you'd like to make remarks on about this one?
So I think one question that I have seen that has come in numerous times, and Dr. White did a great job of answering that, when it talks about they're wanting a definition for a more aggressive hybrid. And so, Dr. White, do you want to elaborate a little bit on how you answered that question? I thought it was a great response. And I think you might be on mute.
You're on mute.
I'm muted. My husband tries to do that daily with me, and it doesn't work at home. I think what we talked about is, and I think Dr. Glass said it best, the decrease the number of people exhaling in the building as possible, because trying to get your entire classroom, your entire school of students and staff in the building all at the same time, the 6-foot distancing is just not physically possible unless everyone was meeting in Rupp Arena, and even that has its limitations. So I think by doing those smaller groups, those smaller cohorts, and varying them through the week is going to give you an opportunity for your students to have that face-to-face time with their trusted advisors and their educators, but also not put staff and students at increased risk. So I think the more aggressive, the smaller, the more spread out you have this, you're going to have less people being exposed to each other.
So if your hybrid model looks a certain way in orange, and maybe that's what's already in your reopening plans that you developed over the summer, then more aggressive in red would be to make those groups smaller to ensure that you have that 6-foot distancing. So, maybe what you've already been doing in hybrid will work for orange, but you want to be a little bit more aggressive in that red model and reduce the numbers.
And I would just add to, when possible, collaborate with your local leaders, whether it's the local health department or local government, maybe if you have a local chamber. And first of all, ask them to do the same thing that you're asking kids to do. I always say we should never do anything that we're not, or ask of anyone else what we're not willing to do. Be really helpful if we could have adults be the examples for the kids. And then also that gives you another line of support outside of the school building in the community as cases rise.
Thanks, all three of you. This next area number 3 that's here, I mentioned there were 5. We're up to number 3. This one is really around when the governor was talking about providing quality virtual learning options for students. Students that are in those remote NTI settings, they need to be quality. And the governor was concerned about reports that he's heard around students that don't have access to AP classes or honors classes or sort of an equitable set of course offerings in the NTI model, that they were being disadvantaged in the weightings around their GPA, and that was impacting class rank. And so when he talked at the press conference yesterday, he talked about not allowing class rank or GPA to be impacted by because a student was on learning in a remote or NTI format. I have seen questions around that asking, does this mean that a student can't get a lower GPA? No, I don't think that is the case with this. What it means is, does the weighting change because that class wasn't an AP or an honors class, and that would result in a lower GPA or class rank for that student? So that's the problem that I think the governor is trying to get at with this this area. We have issued, KDE has issued extensive guidance on this previously. So we have a series of guidance documents that all relate to best practices and how districts can offer quality remote or NTI options for the students, perhaps even how they could partner with other districts on making sure that they have a quality range of offerings available to students. But the question that's really before us is, should this remain a guidance element, which is really where it presently is, or should the governor enact an executive order that requires this? So I'll stop there. Kelly, Lieutenant Governor, anything that you would add here? And then we have this question that people can provide input on, as well as any additional input on this element. So I'll stop there.
I think it just might be worth noting, you want to ensure that your students, regardless if they're receiving face-to-face instruction or if they're receiving a virtual option, it ties back to opportunity and access. Are they having the same access to high quality curriculum, advanced placement courses, different experiences? Now, I know that's a challenge, but we don't want to punish a child whose family chooses to do virtual learning rather than coming into the building. And Dr. Glass mentioned previous guidance documents. Once everything has been finalized from the governor's office, we will release another document that kind of spells everything out. And in that, we will link back to all our previous guidance documents that deal with virtual learning or instruction. There are several that have come from Marty Park and David Cook and the Office of Teaching and Learning. So in the meantime, you can go back to our COVID-19 page and all those documents are listed there, but just try to keep in mind opportunity, access, and revisit the guidance documents that we've issued around virtual learning.
Thanks, Kelly. And a key point of distinction here is that we have a question around should this remain guidance or be put into an executive order? And so this is the mandate question. When things are put into when KDE issues guidance, what we're trying to do is share best practices, clarify questions, give you as local decision makers ideas about how you can best meet some regulation or challenge that's before you as a school leader. But it's guidance and it's non-regulatory, and so it has no force of law. KDE's guidance is just that, it's guidance. Once the governor puts something into an executive order, now following the Supreme Court case around the governor's authority around executive orders, it has the force of law. So that's the difference in terms of authority on this question 3A. So we're asking your thoughts around that and any input you have on this matter. Shifting to the fourth item out of 5 that the governor talked about, we have had the Healthy at Schools guidance document that was broken down into really 2 categories of virus mitigation strategies. One of those was a set of expectations, and they included things like wearing a mask, hand washing and sanitation practices, social distancing 6 foot where possible, as much as you can spread people apart where not possible. So those were the expectations that were in the KDE guidance document. And then there were a series of best practices that were also virus mitigation efforts, but they were not listed as expectations or of the heightened importance that list was. So there were 2 elements within that KDE Healthy at Schools guidance document. The governor is now considering making the expectations component in the KDE Healthy at Schools guidance document required or mandated. We have been relying on the Department of Public Health's authority that schools and buildings all across the state operate safely as why the expectations were mandated previously. But now the governor is considering putting that into an executive order to really clarify that they are not optional. The things that are expectations that are in that KDE Healthy at Schools guidance document would be clearly have the force of law as the governor would if he were to include them in an executive order. So the question here is, do you support adding those to an executive order? Yes, no, or would it make no difference? And I expect that almost all the districts in the state are already following this Healthy at Schools guidance document. So you can provide your perspective and opinion there. And any other feedback that you have on that one. So I'll stop there. I know that Kelly was the chief architect behind the Healthy at Schools guidance document, along with the Department of Public Health and all the support that they provided. So I will pause there and see if Kelly and Dr. White and perhaps the Lieutenant Governor would like to make any statements around this element.
Well, I think when we first built this document, the best practices were things that would be my personal expectation, but I again learn every day from my peeps at the KDE that everyone doesn't have resources to do all of these things. Every school system cannot do everything. So what we did was we teased out those basic things, those basic mitigation practices as our expectations. And then for those who were able to, were given some opportunity of, if you can add this layer, if you can add that layer, if you can add that layer, that just makes things safer. And I do remember, I can't remember which school system it was, but when we did our school board trip that we went around the state of Kentucky and talked to different school boards, we came across a couple of school systems that said we've done the expectations, and we've also put in place the best practices as well. And these were not what I would have expected to be your more wealthy school systems. These are people that knuckled down and figured out how to make it the safest they possibly knew how to do. So that would be the differentiation, Dr. Glass, of the expectations and best practices. Dr. Foster, would you agree with that?
100%. You know, from the beginning, the expectations have been things that you needed to do, you had to do. I don't think the word required is in the document, but it is an expectation that those 5 areas at the beginning. That's why we set those aside and called them expectations. And then best practices, you know, depending on your funds, your space, the size of your building. But I would encourage you, if you know everyone's been out of school for a few weeks, please revisit the Healthy at Schools document. Look at those expectations. Some of you haven't never opened to face-to-face instruction to date. So if you've kind of had Healthy at Schools to the side, you need to pull that back out and really make sure that your faculty and staff have a clear understanding of those expectations in the beginning.
Excellent. Thank you. Thank you both so much. And then the final element, this 5th one, the question is, should we use criteria established in the Food and Drug Administration's Emergency Youth Authorization, so that EUA? And just a bit of context, that EUA was for an experimental treatment for COVID. When a lot of people were dying from COVID, the FDA was trying to identify who is really high risk because of this virus. And it created a set of criteria. It includes things like being having a really high BMI, having a compromised immune system, having a serious respiratory disorder, having a serious heart condition, or combinations of those things, being over 65, or again, combinations of those things. So the question is, can we use a list like that to establish criteria by which, if an employee requests a remote work assignment and they get documentation of that this condition exists, then they're guaranteed to have that remote work assignment. So I think here the governor is concerned that he's heard from school employees who have a comorbidity, an underlying health condition, they're over 65, and they're being sort of economically coerced into working in an environment that is that they feel unsafe in, or that is unsafe because they have one of these conditions. And so what this would accomplish is, again, it establishes some objective criteria by which someone could qualify as having one of these conditions. If they request and there's a documentation that condition exists, they would then have to be accommodated with a virtual or remote work assignment until such time that a vaccine is offered to them. So that's the idea behind this. And so the question is, do you support that? Yes or no? Or does it make no difference? And I again expect that many districts in the state have already talked to their employees, found out who has underlying health conditions or concerns, and made such accommodations available to them already. So that's the question that is on 5A. And then 5B is just ask for any feedback on that. So I'll pause again here and see if Dr. White, Dr. Foster, Lieutenant Governor, any of you have any other thoughts or feedback on this. Okay, well, hearing none, I'm going to stop sharing my screen now. I walked through the Google form here because I really think it's important and encourage you to enter in your feedback into this. We'll make sure that the governor's office gets this information, as does public health. And of course, we'll have it here at the Kentucky Department of Education. We're working toward finalizing these questions around what is included in an emergency order and what that looks like right now. This feedback will be used to inform that decision. Once that is done, then we will be able to move forward with guidance for you that you can use to structure and get ready for school in January. But just as a point of procedure, we are holding that guidance until we get the executive orders done, because we want to make sure that we're not providing something that isn't aligned later with an executive order that comes out. So I'm going to stop my screen share there. And then I think we pop back over to Tony for communication updates, and then we'll do our best to answer the questions that you have.
So really not very many communications updates. I just wanted to share, we do have, it looks like we have about 30 answers already in that Google document. So I do appreciate you all for providing feedback right away. And we do have some private schools as well as public schools in there. And for some reason, if you are a superintendent or school leader that is listening to the webcast and you did not receive that link, please just shoot me an email. It is possible. I was having some technical difficulties, obviously, as you could see earlier, unfortunately. If you can just shoot me an email and let me know if you did not get that, and I will get that to you as soon as possible. The other, I guess we can just get to questions and answers. We'll just take it from the top. You want to go from there?
Let's do that, because I think as long as we've got Dr. White on with us to help answer any questions that are for her, we'll use her time. So let's prioritize any questions about the vaccine, any medical questions, any questions about the color-coded system. We'll use her time while we've got it. Okay.
All right, so we will go to the top of the, we'll start with the soapbox. So we will go into the top here, and it looks like the number one question here, well, we have a couple that are related to the vaccine. If any employee doesn't take the vaccine and they are considered high risk, do we still have to allow them to work from home?
So in what has been proposed, and we don't have any final information on this right now, but in what has been proposed, we've said that if you have one of those conditions, you request an accommodation because you have one of those conditions, you must be accommodated until such time that a vaccine is offered. And so then at the point that a vaccine is offered to that employee, the employee has the accommodation doesn't have to be continued. So that means that the employee, it could be that the district continues to offer that remote work assignment to the employee, or really the employee has the choice of coming back to work in person, vaccinated or not vaccinated. But in any case, I think we are going to see the continuation of all the virus mitigation strategies throughout the rest of the school year, because our vaccination is going to be an ongoing process, and really until we get to that herd immunity level, whatever the medical community decides that's going to be, we're going to need those additional mitigation strategies. But so I think just to briefly answer the question, the accommodation for a work placement extends until a vaccine is offered to the employee. But that may change. And again, we seek your feedback on this. Okay.
The next question, I'm going to just go back and forth to the Google form. We had several to the other Google form where you submit questions. The first question there is the vaccine currently approved for 18 and older or 16 and older? Because they say that they have seen both. Dr. White?
Yes, the ACIP, which is the committee from the CDC that makes vaccine practice recommendations, has approved this for 16 and older. We won't see children younger than that to be approved for some time until they've done more testing. But 16 and older have been approved. And I think I've moved my 3 o'clock, Dr. Glass, so we don't have as much of a restriction as we thought. But 2 other things I wrote down that I forgot to say. If you have already made plans with a local entity to do vaccinations, if you already have a plan with your local pharmacy, please send us that roster anyway, because they will probably end up working through us, and we want to be able to know how many doses to order. That's what that roster is for, is so we can be sure that we order the proper amount of doses for anybody that's going to be vaccinating your staff. And we mentioned this briefly, but I think it deserves more than a brief mention. It's very important to ACIP, to the CDC, to the FDA, and certainly to the Department for Public Health that this vaccine be distributed equitably. So this is not a vaccine that goes to doctors and nurses first. This is a vaccine that goes to healthcare facilities. So this is anyone who comes in contact with that patient, whether it's a doctor, a nurse, respiratory therapist, the person that cleans the room, the person that brings in the food, the person that checks them in at the front desk. We want to be sure that there is equity in how this vaccine is distributed. That figures the same way into your educational facility. This is not just for teachers. This is not just for principals and teachers. This is for everyone in that facility. So again, that includes people that work in your school, whether they be front desk folks, the folks in the cafeteria, custodial staff, whoever works in that school, because we want to be sure that we offer this across the board to everyone. So I just wanted to make a special emphasis about that.
And then we just want to make sure we clarify that these rosters should go directly to the DPH mailbox that is mentioned in the guidance, and not to the Department of Education.
Correct.
We don't want it. It's not that we don't want your rosters. We just want to make sure, because there is such a quick and tight deadline on this, we want to make sure that this gets to the correct place and on time. So please get it to that DPH web address so that they can get these processed exactly where it needs to go. The next question that we have is, will vaccines for educators be provided by local hospitals and pharmacies? We are already in the early stages, are planning with our hospital on getting staff vaccinated. If this is the case, do we need to still send those rosters for staff who wish to be vaccinated?
Yes, we would really like to do this to be sure that we are involved in the ordering, because nobody gets the vaccine unless we order it through Tiberius, which is the name of this big database that's helping us with ordering. So and the people you're working with may already have this under control, but I want to be sure that no school system gets dropped. So if you would still submit that roster to us, and then we can work with whoever's going to be actually putting those vaccines into the arms of your team. But we want to be sure that that order is made, and so we'll be the ones that actually send the order up through the feds for those doses. So please go ahead and send that to us.
So there's a question, I'm not sure if this is related to the vaccine or not, but what accommodations need to be made for the 65 and older school employees? Well,
they certainly are candidates for this. In fact, there is some discussion about maybe 65 and older becoming the 1B group, which, being over 65, I'm all over that, but those decisions have not been made yet. So people over 65, I mean, we're going into nursing homes and vaccinating 80 and 90-year-old folks. So there has not been any evidence that this is something that should not be given to older adults, and very encouraged, because the older adults are the ones that are doing having poor outcomes. Did I answer that question?
I believe so. If not, they will let us know, I'm sure. The next question that I have is it possible for them, and again, some of these may have been submitted prior to them getting some guidance that we had sent, but wanting to know if they can get some guidance about the vaccines from DPH prior to them asking their staff if they're willing to receive the vaccine. I think they think that if they can provide their staff with the scientific information, that we may be able to, we being them, will be able to combat the fear that they have. So just wondering if that could be a possibility to get out there for them. Is that something that you have or that you've put together?
Well, what I would do, and I will find the best link for you, but the CDC has already put these together, and they're nice. I mean, when we put something together, it would be a Word document. They've already got these things put together in a very user-friendly capacity. So I will find that and send that to Tony, some links for you. That's a great idea. Reading through your chat, there is a myth out there that the spike protein on the coronavirus is very similar to a protein that's in the placenta, and that if you take this vaccine, it will attack your placenta. That's just not so. Those proteins are not that similar, and so there's no carryover that we're aware of. We do know that pregnant women have more problems with preterm delivery, things happening later in the pregnancy if they are COVID positive while they're pregnant. We have not seen an increased number of women who have COVID and are early in a pregnancy and having more miscarriages. We're not seeing that. So I can safely say that the infertility issue is a myth. And what was the other? Oh, and allergies. And I went over that, but it's worth saying that again. The 2 people that had a reaction in the United Kingdom to this vaccination, one of them had already had an anaphylactic reaction to a vaccine in their past. Another one had had an anaphylactic reaction to an intramuscular injectable. Those were the only 2 people out of the thousands of doses that were given in the United Kingdom that have had this kind of reaction. This is not people with run-of-the-mill allergies, not if you have a penicillin allergy, not if you're allergic to bees or shellfish or a whole host of things that people have allergies to. Just having allergies does not mean you can't take this vaccine. It is only people who have had anaphylactic reactions to a vaccination or some other intramuscular injectable. So that's a very, very small group of people. You're unlikely to run into that. So I think you can give people that reassurance right now for that.
Okay. Next question. Are school board members eligible for the vaccine?
I think that's a great question that we haven't had yet. Let us do some work on that and talk about it. Yeah, and we're going to rely on public health's guidance on where they would fall in this.
Okay. The next question, how do we deal with an employee that refuses to take the vaccine but does not want to work because they are at high risk?
Well, I think that the governor's executive order may clarify that, or should clarify it. So we won't know definitively the answer to that until we see the language that's in the governor's executive order. And what we've proposed today, which may or may not be what the governor actually puts in place, the employee, once they're offered the vaccine, the requirement around a remote work accommodation ends. So the employee's choice is to work vaccinated, to work not vaccinated, or they're not able to do the job.
Okay. I'm looking here to see more on will the vaccine be mandatory for, well, obviously not students because it has not been approved for students, but will the vaccine be mandatory for staff?
We don't have any authority at the Kentucky Department of Education to require this vaccine. I have not heard anything from public health or the governor's office suggesting that they intend to require the vaccine, or that they have the authority to do that. It is it can be a local determination as to requirements around that. I think we've got Todd Allen on, who has researched this question around what options school districts have around requiring the vaccine. Todd, are you able to come on and provide some insight on this?
Yes, thank you, Commissioner. As the Commissioner indicated, we have some information that the EEOC, which is the Equal Employment Opportunity Commission, has previously issued guidance on a mandatory flu vaccine for employees, and their guidance on that required that any employer making a flu vaccine mandatory would have to have exemptions for religious objection as well as for individuals with disabilities. The EEOC has not issued guidance on a mandatory COVID-19 vaccine, but we suspect that if they did, they would utilize the same logic. That is, that any employer would have to require exemptions for religious objection as well as for individuals with disabilities. Just of note, we also noted in our research that these vaccines that are currently under emergency use authorization, one of the caveats of emergency use authorization indicates that individuals have to be notified of their ability to refuse a vaccine, and typically that means that states aren't mandating that vaccine. The situation gets a little bit different for employers and even public employers versus private employers, so that's the reason that we would encourage you to reach out to your board counsel and have a conversation and receive legal advice on that topic. We can't offer that, but obviously at the very least we want to strongly encourage employees to take the vaccine.
Okay. Next question, will there be a cost for the vaccine?
No, this vaccine is being provided by the federal government and distributed across the state. So no, there is no cost at this time.
Okay. Next question, does the availability for vaccinations for school employees include private schools in the Commonwealth?
Yes, we are planning on whatever entity does the vaccination in a local community, whether that's the Department for Public Health or whether that's a contract with a pharmacy, that opportunity will be open to the private as well as the public schools.
Okay. So it looks like those are the questions. I'm going to flip back to the Google form real quick to make sure that there are no other questions on vaccinations. There are quite a few on the other. So it might take me just a minute to kind of gather them all together. Hold on one second here. Oh, wait. Nope, that's not a vaccination one either. So I guess I'll just take it from the top. If I get a vaccination one in between here, I'll pop those in there. I will go, well, actually, there's another one. The cost, let's see, is there something about a cost for a doctor's visit or urgent care visit to receive the vaccine?
As long as in this Operation Warp Speed distribution, there won't be, but Dr. Woods Tucker is correct. That has happened with some of the COVID testing. The COVID test was covered, but the doctor visit might not have been. These vaccinations are, since this is being provided free by the federal government, and these initial deployments that we are helping to arrange will not have that type of cost, and that's an important question. But we're not at that place right now. Tony, Robin Kinney, the Associate Commissioner, has found a nice link to the CDC that has, I think, the kinds of information that the superintendent was asking earlier. So if I can either share that screen or just send that link to you, however you want to do it, I'd like to pull that up before this team leaves today so you can see and make sure that this would give you the information you need, and if I need to do any more legwork.
Oh, sure. You should. If you're not able to share your screen, we can make sure that you're made a presenter. I'll check with our IT team. Are you able to share your screen?
So this is the CDC website on vaccination. It's got it in different languages here. So if you are interested in that, and so this is going to be, it's directly related to healthcare personnel, this first issue here, but things that you would need to know about the vaccine program, who gets it first, benefits of getting the vaccine, all of these different things are listed here. So if frequently asked questions about the vaccine, and so I think that will probably cover the issues, and it'll be well done and very succinct, and I think it'll give everybody the information. How was it developed? Who should get vaccinated? I'm sorry, I'm going so fast. You're going to need some motion sickness medication. Wearing the mask afterwards, we have talked about that. So so I think that might be what you would need, and would be something that's readily available that you can bring right up for your staff. So we can send that link out if you think that would be helpful, Tony.
Okay, sounds good. All right. The next question, we're going to go to the top of the soapbox with a lot of likes. I think Dr. Foster might be able to answer this one because it looks like she had a response in there. But can we have a definition for, quote, more aggressive hybrid?
That's what Dr. White addressed earlier.
Oh,
So,
gotcha.
you know, if you have a hybrid at the orange and you're going to move to red where it says more aggressive, then you have a smaller group that
Okay.
ensures the 6 feet distancing.
Gotcha.
So I just quickly on this, how you might accomplish that. And again, this is a recommendation, so school district has flexibility in deciding how to do this. But let's say you're an A-B model. You might change to an A-B-C-D model, or you might have a half of the A students in one day and the other half of them in on Wednesday or something like that. So those are the ways that you could, if you're doing a hybrid model, you've already reduced the numbers of students that are present in the building. You'd be thinking about ways that you could structure the schedules to reduce that even further.
Okay. The next question, the governor mentioned that we had to make accommodations for teachers with health issues. Are child nutrition and transportation folks included in this?
We don't know the specific answer to this yet because we haven't seen the language that's in the proposed executive order. However, if the governor were to include all school district employees in that executive order so that these, if they have one of these conditions and they've requested this remote work accommodation and the executive order covers all school employees, the answer to this would be yes. But we'll have to see the specific language before we're able to answer that definitively.
Okay, with winter break starting Friday, we will have so few staff available to do planning if there are major changes to the rules. Can we please get requirements today?
We're doing the best we can. We won't be able to provide any guidance on this today. We will have to wait until we have definitive and completed executive orders before we're able to issue guidance.
The next question, let's see here. When
Tony, before you go to that next one, I think it might just be worth saying too, you know what's in Healthy at Schools. That's not changing. So, how your classrooms are set up, how you're running your transportation, how you're running your food service and spacing out. None of that's changing in that Healthy at Schools document. So, continue to use that as you plan for your reopening.
Correct, and I just want you all to know we are absolutely mindful that winter breaks do start for you all on this week, and we are trying to work as quickly as possible on that. So our goal is to get that to you as soon as we can on that. And then and with the Healthy at School changes, the next question that we had in there is there any way that they can be highlighted, and have there been any changes since December 7th? And the answer to that is yes. All of the changes to the Healthy at School document are indicated on page 6. And so at the top, when you download that document, you will see on the top page what the most updated date is. And if you go to page 6, you will see what the changes were made. And so the last change was made on December 7th. So if you have any, go ahead on that.
So Tony, just to circle back on that question before around the timing of things, I do think that we're going to have to wait until we get something finalized before we can issue guidance. But to the point that Kelly just made, you've heard that there's a recommendation on moving back school till after January 11th. So that's a decision you can make now if you decide to move it back. You can do that independently if something comes out or not. You've seen the changes to the color coding system that the Department of Public Health has put out. That's already been released. So you can start planning for that. If you're already offering quality virtual options or considering those elements around GPAs or weightings and sort of the course parity, that's something that you can move forward with now. The expectations that are in the Healthy at Schools guidance document, if you're already following those with fidelity, that would be no change for you. And on the last point, if you've already made accommodations for employees that have significant underlying health conditions, that means no change for you. So I think if you've been meeting the mark on all these points all along, this doesn't mean a significant or jarring shift for you in terms of what schooling looks like in January.
And again, the changes to the Healthy at School are always reflected on page 6. I've seen several questions about that. If it is helpful for you all, we can, certainly send out an email. We don't update it all that often, but that's feedback that if you would like us to provide, please send me a note if that would be helpful, and I can take that in, to consideration when we update those documents. That last
Dr.
change.
Foster, my memory is the only change that was made this last time was that the CDC changed their quarantine numbers of days, and we just reflected that. So that was the only change that happened in December. So it's essentially the same document that it was the first day of September.
Correct. It was a real minor change. I can't remember which page number it was because I'm not looking at it right now with some of the issues I'm having with my second monitor, but all of those are listed there. All right, the next question that we have, I will go down to the next one. Just to be clear, the orange and red levels on the color-coded decision-making matrix will be a recommendation only. Is this correct?
Yes.
Okay.
Yes. And KDE did see the changes in that color coding before we actually released them yesterday.
Okay. We have teachers of low incidence students, in parentheses, special needs students, and PASS teachers who work with students with behavior issues. Wondering how these folks can work from home. Just, I guess, asking for some advice on working from home with those students. Is Greta on?
Yeah,
Yes.
if you have a student who has a disability, that what's listed in the student's IEP must continue to be delivered regardless of the situation, or compensatory services are owed. So I think many of our schools have already figured out ways to deliver several special education services remotely, or to bring students in person, bring students in small groups. That's continued in the targeted instruction that's happening right now. That certainly could continue. So I think that there have been ways the districts have continued to meet the requirements that are in the IEP. Now, in this case, if you have a special education provider who has a comorbidity or something that needs to work remotely, I think the question is, how does that work? Well, I think in that case, it would depend on what is the service that the special education provider provides and what are the needs of the student, and how can the district reconfigure staffing to allow those services to continue. It's not an easy, I don't mean to understate how difficult this is from a staffing perspective, but either the district finds a way to deliver these in an alternative format, deliver them remotely, have another provider deliver them, contract to have it done, or you're going to be doing the compensatory services once we're past this crisis.
Okay.
And Greta might be on to provide more detail, but those are my reactions to that question.
I think you did an exceptional job. Nothing else to add.
All right, the next question is, what is meant by negatively impacting a student's GPA?
So I think what the governor is hearing on that is that, let's say you've got a GPA weighting system where it's 0 to 4 points. And as the student earns grades, their GPA starts to build. But then you have a system laid over that where if a student takes an honors class or an AP class, they actually can get an additional GPA bump for that. So it makes it a 5-point scale instead of a 4-point scale. And so what that means is that if you have a student who chooses a remote option or an NTI option, but they can't take the honors class because your school district is not offering that, the governor is concerned about that student's GPA and class rank being impacted because of the weighting structure. I believe that is the concern that the governor is trying to get at with this element. We again have issued extensive guidance on this matter before, but the question that's before you is, should the governor enter that into an executive order, and what feedback do you have on that? So we've got that Google form again, that if you have feedback that you'd like us to pass on to the governor's office, that would be the place to do it.
And also, Todd Allen brought up a concern also that the ability to get higher, may also increase your keys money as well. So that's a good point to add as well. Next question. Am I correct that the Healthy at Schools document says you provide 6 feet of social distancing in classrooms when possible?
That is what it says.
And I that's interesting that you can take that phrase and make it into anything you want to. That means you could be 5 inches apart if it's not possible. And that certainly is not the intent of why we put that phrase in there. We put when possible because there were some people say, well, what if we can get them 5 feet apart? Are we going to be penalized if we can't do the 6 feet? And so we decided to phrase it so that you could make that as best as you could get to 6 feet. But I think if you are really sitting down and thinking about the safety of your students, you're going to keep them 6 feet apart. That is the absolute gold standard, best of what you do. The closer together they are than that, it increases risks. And I don't think there's anybody on the call that really wants to increase a risk. So that phrase was put in there to give some grace. As the Lieutenant Governor tells us every time I hear her talk, we need to give each other grace, but it is not there to give you a loophole that you can drive a double-wide trailer through. So please be mindful of that as you're making those plans.
Okay. Will a local superintendent be contacted if any of their stakeholders, i.e. students, parents / guardians, community members, or employees contact the Department of Education or the governor's office about COVID fears?
I think that's going to depend on what message we get. I mean, we get hundreds of emails a day with people that have fears about COVID or share opinions about any number of things related to school operations or health or vaccines related to COVID. Some of those are appropriate to return back to a local superintendent and some are not. Sometimes we can tell what district the person is in and sometimes we can't. Sometimes they're making a statement or an allegation and sometimes they're not. So I think it depends on the circumstance. What you can count on from us is that if we receive concerned or an allegation that's made to a school, we reach out to the school district and provide that information. And through the labor cabinet, they received a bunch of concerns that were listed into a database, sort of a reporting database for COVID workplace concerns. We sent out dozens of emails and letters to superintendents this week to make superintendents aware that those concerns had come in. So I think the best answer in this is it depends on the context of what's in the message, but to the extent that we have something firm and identifiable that we can send back to a school district so that you're aware that it was raised and the concern was made, we will certainly do that.
Okay. The next question regarding the mandated Healthy at School guidance, is desks facing the same direction a requirement now? We have used tables with plexiglass dividers successfully for 2 months and are not able to completely change our classroom furnishings. And as an, I know that Dr. Foster responded and said the expectations in the document are what you should focus on as a requirement. And there was a follow-up question that just says, they had students that were not facing in the same direction, and they just want to know if that is now going to be enforced, or can they still use their current system of children at tables 6 feet apart, but facing towards each other.
I think I got lost somewhere in there, moving desks and tables around. But I think what you think about is, can you keep these students 6 feet apart? Is the ultimate goal in the guide. And so, Dr. Foster, maybe you followed that question better than I did.
Not really. No, I mean, I think it goes back to the expectations in the Healthy at Schools, and you need to try to implement those as much as possible. And then once again, we don't know what's going to exactly be in the executive order, so we kind of have to wait until we have that. But what you need to focus on right now is that color-coded matrix, the Healthy at Schools document. We're not asking you to change any arrangements that you've been doing up until this point. So, if you're using plexiglass and having your students 6 feet apart, it sounds like to me you should be fine.
So let me see if I can clarify this question just a little bit. I think they're asking, is having all students facing the same direction an expectation that's in the Healthy at Schools document?
And that recommendation was to try to get as many students in a space safely if they were all facing the same direction, as opposed to people being in a circle and those kinds of setups. So that's the intent, is to try to get a safe spacing of students in a classroom setting.
So I think the concern, not to belabor this, but I think we could work toward an answer here. The question again is it an expectation in the Healthy at Schools guidance document that students are facing in the same direction? And where that concern is coming from is if the expectations that are in that document are put into an executive order and have the force of law, that means that a school district that hasn't had everybody facing the same way would have to do so. So it comes back to is the facing the same direction question, is that an expectation, or is it a best practice in the Healthy at Schools guidance document? It's an empirical question. Like, we can look it up and see, but I don't know it off the top of my head, but I think it's something that we could look through the document and determine which one of those categories it's in.
Okay. We can perhaps look and perhaps have an answer or clarification for that one by the end of the webcast. Let us get an answer to that one. Yeah. I can kind of see where that is. That one's going as well. The next question, we have been told by KDE that it is illegal to pay someone for work when they are not working. What should virtual work look like for hourly employees, such as transportation, nutrition, etc.?
Well, I think that there are a number of things that those staff members could do. Training is one of them. Work that is could be delivered or brought to that employee's home and done is another. Those are two examples that come to mind on how you could use these employees. They could also be assigned other tasks that some employees are doing that could be delivered at home. So you may have nutrition staff or transportation staff that are doing record keeping or other work. And I think that we have to keep in mind that we're not talking about an extended period of time. We're not talking about having to do this for 6 months or something. It's an abbreviated period of time because we're in the vaccine distribution phase of this crisis.
Okay. The next question I have going on here is, let's see here. Let's see here. Oh, that one just jumped. Somebody must have liked it. Does Educator refer to teachers and other staff? If staff cannot perform their job at home but meet high risk criteria, how do we respond to that?
Well, we touched on this some before. We don't know the answer to that until we get a finalized executive order and who does that extend to. But if it includes if the executive order includes and covers all employees of a school district, if they have a qualifying health condition and they request the accommodation, they have to be accommodated and provided a remote work assignment until such time that they're provided a vaccine. So that means if you haven't been doing that, you're going to have to figure out who qualifies for that and provide them a remote work assignment and provide them work to do from home.
All right, the next question. We were told our numbers would go down if we let kids out of school. Our number would have, or if we let, sorry, let me rephrase this. We were told our numbers would go down if we let the kids out of school. Our number would have gone up over 500%. Please tell me what punishment my district will receive if we come back to school 5 days a week in January.
I don't know what's going on with that question. I would say email me that question and I'll be happy to dig into that and provide an answer for that. It sounds very specific and there's something that someone wants to do that's very specific. So I'm happy to work through that and see if we can provide an answer to that. I think the answer is going to depend on are you violating guidance, or in which case you're exposing your district to liability, or are you violating what will be a future potential executive order, which would mean that you're violating the law and you'd need to make a correction to that. So my response is email me the question and we'll work on providing a response to that for you.
Okay, it looks like I can't tell which one that came from. Looks like it came from Bill. I didn't have a last name. Next question. I will get asked this from staff. Why do we have to include an employee's age on the roster for the vaccines?
That is there just for identification. So when you show up with an ID, H1N1 is the most recent type of vaccination issue, large scale issue that initially there were very few vaccines to deploy until the manufacturing was increased. And so people there were certain groups of people that were allowed to get the vaccine first. And so people were falsifying records and trying to quite frankly, cut in line and do this nefariously. So we felt like the age was important, just so, as I said in my example, so Connie White doesn't show up with an ID that says I'm 24 years old. It wouldn't take a rocket scientist to know that I am falsifying my who I am. So this is just a way to make sure that we don't want date of birth, we don't want any of that kind of information, just an age, so we know that we're looking at the correct person.
Okay.
And Tony, looks like we have had the team at KDE also research that question around the facing in the same direction. It is in the expectation section. So if the Healthy at Schools guidance document is the expectations are listed in an executive order, that would be a requirement. And Lieutenant Governor, I see that you've come on. Is there something that you'd like to add?
Yes, I was just going to make a comment real quick. And, the first thing is I would say that obviously every superintendent that's on here right now is thinking through what this looks like in their world. And I think a lot of these questions are intended to be to make sure that you're following and doing what you're supposed to be doing. At the end of the day, I think if you are holding kids harmless, if you are making the best decisions on behalf of your faculty and staff for their safety and the safety of their family, and you're doing the absolute best you can, then you're doing everything that you can do. So I know a lot of these are about very specific situations. It is very easy to get down in the weeds on this. Believe me, I know. But at the end of the day, we're providing the best medical guidance that's out there, and asking you to lead and asking you to be able to make those decisions locally. And so I appreciate that everyone has been so thorough and making sure that they're doing everything right. I hope you know that the trust is there for you to lead your district and to do right by people. And at the end of the day, that's really all we need to do.
Oh,
Thank you, Lieutenant Governor.
all right. Next question looks like it's coming from Doug. Trying to look at what point does student learning become a priority? Sorry.
Let's move on.
Okay. Next question from there is, can the Healthy at Schools document be sent in a format that you can read the text, especially in the red column?
I responded to that one already and told them where they can download that.
Right. I think they're talking about the new color-coded map. And okay, so you can download that on our website. I'm just thinking for those that may not be able to see the soapbox. All right, the next question. Will you be sharing the responses of the superintendent survey with the superintendents?
The one that we're collecting right now?
Yes.
Yes.
I believe that there's several references to that. Yes.
Sure. We can send the feedback back to the superintendents. Sure, we're happy to do that.
Okay. Is it possible to postpone the date from December 30th to the first week of January for the rosters to be submitted?
We are going to be submitting at the end of the month our vaccination requests, so that's why that date was picked. I'd love to say yes, but logistically that's not going to work. I'm sorry.
Okay. Next question looks like Matt. Are the private schools being subject to the same criteria as the public schools?
Criteria for?
Just says criteria as the public schools.
Well, the public schools have the same opportunity as the private schools have the same opportunity that the public schools have to be considered at a priority group to be vaccinated. So the public school teams as well as the private school teams are both in that group. So I think the answer would be yes.
Okay. What do we tell parents when they ask why teachers are getting vaccinated and not their students?
We don't have medical data to show that it is efficacious for students yet for under 16 years of age. And so that isn't available yet. The CDC nor the FDA have approved it for children at this point.
Okay, the next question is, will the new guidance be differentiated by elementary, middle, and high schools? It seems like the recommendations do not have equal value for all.
We have discussed different requirements around different school levels, but what you've heard today around the 5 areas that the governor talked about, it's not differentiated by different school levels. It would apply to all schools.
Okay. The vaccine spreadsheet has 4 columns: district name, school name, employee name, and age. Does this spreadsheet only include employees who wish to take the vaccine?
Yes.
Correct. So just to clarify.
Yeah.
Go ahead.
Yeah, we're going to take that roster and so we'll just count and we'll use that number to order, and then we'll use that list. So when they show up to get their vaccination, that we'll be sure that we have them on the roster. So that's a good question.
Okay. Does the mandated accommodation stay in place until the second dose of the vaccine is administered?
Accommodations.
It's the requirement that an employee be provided a work accommodation if they have an underlying health condition. Again, we don't know the exact answer to that. I would advocate that the answer to that should be yes, because you don't want to you want to make sure that the employee has the full protection of both the vaccine and the booster, or Dr. White will know the second dose. Before requiring them to return to work.
Follow up on the vaccinations. Do private schools have to submit a roster to KDE? And just a clarification, the rosters are not coming to the Department of Education. They're going to the Department for Public Health. Kelly?
Well, I responded to that one, but for anybody else that didn't see that, you can go to Katie's webpage if you did not receive the vaccination guidance and go to the COVID-19 resources, and that guidance document is there that tells you exactly what you need to do, public or private school, how to make your rosters, and when to submit those by December 30th, and it also gives you the email address to send them to at Public Health.
And we will use those rosters to order the doses. So if we don't have a roster, we won't order doses. And then when time comes for a vaccination for your school system, we won't have any ordered. If we had millions of doses coming to Kentucky, this would not be an issue. We are trying to accommodate to get as many doses out as quickly as possible. So the roster equals us ordering those doses. So please get those to us so we can get those ordered for your education team. So
yeah, if the key word there is have, do they have to do it? The answer is no. This is a choice on whether you want, if you have employees that want to receive the vaccine, then this is how you can submit the roster to get so that they can be properly ordered. Because I see that question here several times. Do we have to submit these rosters?
If you don't, they won't order vaccines for you.
Yeah, correct. The next question is, will the vaccine be open to our students between the ages of 16 and 19, and at what timeline?
That's a very good question. Right now we have healthcare workers, long-term care facilities, first responders, and the education community. We have not differentiated who gets the vaccine after that. There's some discussion on the federal level if the next group should be people over 65 for starts. There's another camp in the federal level that says that it should be essential workers, and there's a whole list of people who fit into that category. So the federal government will make a recommendation, and then locally the Department for Public Health can choose to agree to follow that. I mean, I don't know of any other state that's putting the education team at the front of this line like the state of Kentucky is committed to. So to answer that question, I would think probably 16 and 17 and 18-year-olds will be in the general population unless the groups with high comorbidities comes up earlier in the list. And then if they happen to have that high comorbidity, they would be in the team. So in that category. So we don't have those lists at this present time. Right now, we're just trying to get the vaccine manufactured and deployed into the first tier groups that we have already assigned.
Okay, so just a clarification. They say that they know that it's been stated that the updated color-coded matrix is on the KDE website, but they say that they cannot find it.
So I have sent Tony the updated document while we've been on here and asked her to put that in a PDF and send that out to everyone. So it will happen after the webcast.
Yes, I'm pretty good at multitasking, but I cannot do that. So I promise it'll be updated as soon as we get off this webcast, and we will make sure we get that to you all. The next question is, let's see here. Rephrasing of a question. Is facing the same direction required if they are, I guess this is going back to the desks. Is facing the same direction required if they are at least 6 feet apart?
I think both of those things are listed in the expectations. So you'd want to be 6 feet apart, ideally 6 feet apart and facing the same direction.
Okay.
And the facing the same direction was to get more better use of your space in your classroom.
So the only exception to that, the guidance document does talk about 6 feet where possible. So you may be less than 6 feet if that's not possible within a classroom, with all the caveats that Dr. White's put around that shouldn't be used as an opportunity to abuse or ignore that provision. But what we have these layers of mitigation factors to try and make the school as safe as possible. If we're facing in the same direction, that's safer than not. If we're 6 feet apart, that's safer than not. So that you want to layer up these things to try and improve the safety.
Okay. What documentation will employees receive that shows that they have been vaccinated, and do we need it?
Well, when a vaccination is given, it will be entered into the Kentucky Immunization Registry, and there will be a document produced. I can answer that part of the question. The second part would be up to Dr. Glass.
Yeah, I'm not sure. I think we'll need some legal advice on this, on what we can ask for, and so let's save that one. I know Todd's on here. Todd, let's take note on this and circle back, and we will provide additional guidance on the questions that have come up. Let's add this question to it, and it really is around can the employer request or require proof or documentation that an employee has had the vaccine?
We'll look into it.
Okay. Perhaps another legal question. Superintendent's asking if they can, for the documentation for the Department of Health, they're wanting to know if they can ask for the date of birth from their employees. They're just wondering if that might be a potential. This may cause people to wonder about discrimination or take a moral stance on it. They're just wondering based on a survey that they may have administered.
Well, if you ask them their date of birth, I think you're going to know what their age is. So we were trying to stay away from us having in our possession anything that if someone were to hack and get my date of birth, if my name and date of birth is on there, we were just trying to stay away from anything like that. We just wanted a general idea of who was showing up to get their vaccine, to try to keep people from falsifying their identification and getting a vaccine when they weren't supposed to be getting one.
Okay.
And Todd says that the district already knows the age of its employees. So.
Okay. Next question. That did not work. Sorry, I was trying to post a link in Twitter so you all could see the, but I'm trying to multitask, y'all. It's not working very well. So I'll just wait till after the webcast is over. If we have a large number of employees that are immunocompromised and are able to work from home, how do we safely supervise large numbers of students or safely transport students to and from school?
You may not be able to. If your workforce is unable to come in because they are immunocompromised and you can't staff it, you may have to be in a remote setting until such time that we pass this crisis. So I think that's going to be a local decision. You're going to have to look at your available workforce. What do you need done? How can you staff it? And can you continue with in-person learning? It's somewhat related to the problems that we were seeing when we were having large swaths of employees that were being quarantined and forced to remain home so as not to be vectors for the virus. So there may be workforce disruptions that push you into an all NTI or all remote setting.
Okay. The next question, and this is again, I'm going back and forth to the Google form. Will the Emergency Paid Leave Act be extended beyond December 31st, 2020?
I don't know the answer to that. I think that's a legislative and congressional question.
Okay. When we return to in-person classes on January 4th or 11th, will there be a cap size for the number of students who attend each day?
In what's been proposed, there are no firm caps. So long as you're meeting the social distancing requirements, there are no capacity caps in any of the elements that we've discussed today.
Okay. Going back to the soapbox. Okay, vaccine is the opportunity of a lifetime. What is the anticipated date of arrival for the first educator to be vaccinated?
We're taking bets, I think. No, Dr. White, what are you thinking?
Well, the governor said on his press conference the first week of September. February. Gosh, I'm into school, and school is September. February. Part of that depends on, the biggest thing that depends on is how much vaccine is produced. If we can get adequate doses to take care of our healthcare providers, community, as well as long-term care facilities, as long as our first responders, if we get 38,000 doses a week like we did this week, it's going to take a long time. We don't expect that. We're expecting hopefully 70,000 doses of Moderna next week, and another 78,000 after that, and then another shipment of Pfizer the week after that. So as soon as it gets to Kentucky, as soon as it lands in Louisville and we get that deployed out, that will be in people's arms within days. So as quickly as the manufacturing can keep up with what we can do, that makes the education community come to the front faster.
Okay. The next question is, and then, sorry, going back and forth here. I'm trying to make sure I get to the ones that we have not asked. Is staggering arrival and dismissal a mandate, or can there be decision-making autonomy to reflect what works in individual school environments?
We haven't discussed anything that would direct or dictate dismissal and arrival procedures and times at schools.
Okay. Next question, do student workers, for example, STLP, bus monitors, etc., get included in our COVID school vaccine roster that needs to be submitted by December 30th? And my assumption, although it is not stated, is that these students are older than 16.
I don't know. I don't know if we've had that. I wonder, and I don't know if they're employees or volunteers. Like if this is a student that's in a work assignment, like a student assistant position, or I'm not sure. Let's have whoever asked that question email it in, and let's see if we can look into that, because that's one we haven't heard.
I do have the name of that person that has submitted that, so we might be able to reach back. But if they are still listening and can email us directly, that actually might be quicker on that one. All right, next question. What type of virtual work assignments are districts supposed to place bus drivers in? I think we've already addressed that one. Sorry, that one slipped to the top there. Next one. I think that there's questions about if a school is not going back to in-person classes, are districts prioritized over them? I don't know if this is in reference to vaccines. I don't think that there's necessarily, Dr. White, did you want to address that one, or Kelly? I don't think that there would be a prioritization.
No, just if someone chooses not to go back to school in person on the 4th or the 11th, where they are in the list of who gets vaccinated will not depend on that. When and where schools will be, that school staff will be vaccinated will depend on the logistics in that community and how quickly we can get that deployed and get a plan in place for them to get the vaccination. It has nothing to do with whether they're in school, out of school, face to face. That's not a public health concern.
Okay. Lots of questions on what our best guess is for when the governor will issue this executive order. I'm not sure if the lieutenant governor is still on, or if she's got any more updates on that, or if Dr. Glass has been updated, but there are several, probably about 5 or 6 questions related to that.
Yeah, I can tell you that the legal team is working through it right now, putting the finishing touches on it. And so my answer is as soon as possible. I'm really pushing to get it out before the end of the week. And so we'll have to keep you updated on that. But it's in legal now.
Okay.
And we have been, the legal team, Todd's team at KDE and Kelly have been also working with the governor's office, providing feedback and revisions to that. So it is in process, but I think as we've heard today and as we process through, there are some key decision points that are still outstanding. The feedback that you provided will inform that decision, but we all understand that there's a need for expedience in this.
Okay, a couple of good questions that come into the Google form here in the last minute or two. What if someone changes their mind after the roster has been submitted? Can we update or submit after the 30th? Or should we tell employees that this is their only window? If someone has an allergic reaction, I guess we could just take it apart question by question. Let's start with that one.
Okay. If someone submits their name on the roster and changes their mind, of course, we're not going to force anybody to have a vaccination. But unfortunately, if we don't know the number of how many doses to order by the 30th, then we will not have those doses available. So it behooves the employees to make that decision as soon as possible. And hopefully, if that link to the CDC question and answers about the vaccine may help people who have questions.
Okay.
Yes, so this would be their window. And if they don't get it in this window, there still will be vaccine offered later. But it is their way to get the education team that the governor and the lieutenant governor have gotten offered to the front of the line from others. It's their chance to take advantage of this.
If someone has an allergic reaction, are we liable as a district if we strongly encourage that the vaccine be taken? And do we know, are we able to tell them which vaccine they will be taking? Will it be a combination of either one?
Well, it won't be a combination because if you get the Pfizer for their first dose, then you will get Pfizer for your second dose. And I will not pretend to answer the rest of that question. I'll leave that to Todd.
Yeah, on the liability question, of course, we can't give districts legal advice, but I would encourage you to speak with your board counsel. From our perspective, that's of very little concern. You know, employers every year encourage their employees and host events to give them the flu vaccine without any type of liability concerns involved. So from our perspective, you know, as an employer as well, that seems to be a very, very low concern from the liability perspective.
And I also think it has to be balanced against the alternative. I mean, the alternative is that you would say, well, we're not going to vaccinate our staff and community. And therefore, we continue with what we've been experiencing for the last several months, which is, to me, it's a risk-reward calculation, and the reward is worth it.
And I missed a part of that question. Which one will you be getting? Again, that depends on logistics. We will probably be using the Moderna vaccine in the more rural areas because it does not require the cold storage, the strict cold storage requirements that Pfizer does. So again, it's a huge logistic issue as to what you will get.
Okay. And I know we only have about 2 minutes left. There's several other questions. I do appreciate the we did get someone just emailed me about that student worker question, so I do appreciate that one. There was a question, and I can't seem to find it, about the ATCs in there, about who needs to submit or provide roster info. And I wanted to make sure we got to that one because that is very timely. I'm not sure if David Horseman is still on or if the commissioner wants to address that one.
So
yes, I'm still on. And I was just talking with Kelly about it since we'll be providing the information on the rosters. And I think due to the multiple locations, we will probably have the ATCs send their information directly to DPH because logistically they'll need those doses located where the school is.
And also,
but we're going to send that out tomorrow probably.
And also there is a specific bullet in the guidance about area technology centers and local centers, and it tells you specifically what you need to do depending if you're an area technology center or a local center.
So Tony, I think we've got about 1 minute left, so I'm going to go ahead and bring the session to a close. We want to thank all the superintendents and other school employees and everyone who was able to listen in today. I think this is an honest effort to make sure that we are able to effectively and efficiently deliver a vaccine once that comes in and is available, and make sure that that gets to school employees. We thank you, Dr. White, for being on to answer our questions about that, and appreciate your efforts and Dr. Sack's efforts to support our school employees in receiving that vaccine. And you've had the chance to hear some of the concepts that the governor is and the governor's office are working on around the conditions under which we return to in-person learning in January. There certainly is a path to the restoration of local decision-making when it comes to that, and a return to in-person learning. But there are some conditions that come with that, and we've processed through what those look like. I know that there's a number of technical and detailed questions that arise in your district and your community that you'll have to problem solve through. We've done our best to try and answer those, listen and be forthright in advice and guidance on those, and know that we will continue to work with the governor's office to provide the guidance for you on how you can execute what's listed in those executive orders and the guidance that has come out, so that you're able to restore in-person learning safely and make sure that you've got quality learning options available for your students. We're working on that right now. We appreciate your patience and continued grace. We know that we've extended a lot of people's capacity for grace, but we ask that once again. If I don't get a chance to connect with you or see you over the next couple of days, happy holidays to everybody. I hope you take some time with your families to decompress and enjoy being with each other in this incredible and special time of year. Thanks, everybody.